All right, who doesn't want straight teeth? And these days, it's easier than ever. No braces needed. Here with the details on Invisalign with Water's Edge is Nicole Dahlkemper and Cheryl Johnson. I should say Dr. Dahlkemper. How are you?
Good. How are you doing?
Good. And look how Cheryl is smiling. Why? Because Cheryl loves her Invisalign, and I can't believe you have it in right now. I really can't even see it.
I do. I have it in all the time.
Do you feel like, what does it feel like? I mean, for those, because I had braces, I didn't have.
It's a lot better than braces, I understand. And they're very easy to wear because they're in all the time. You don't have to take them out. You don't have to feel like you have a lisp when you talk. I naturally have a little bit of a lisp anyhow. But they're easy to take care of. You just pop them out when you eat, clean them off, put them back in after you eat. I can drink coffee as long as I rinse my mouth out.
Wow,
yeah.
That's amazing. Well, Dr. Dahlkemper, who would be a good candidate? Because we were just talking about this. I mean, someone that's already had braces, they might not be satisfied with the results that they have now.
I have a lot of patients ranging, I mean, patients who are 15 years old. I have patients who are 65 years old. So age really doesn't matter. Some patients, if they have spacing, if they have gaps in their teeth, or even if they have crowding, their Invisalign comes out with, you know, updates every year, and the product's getting better and better, so we can treat more and more cases.
I can imagine, and it looks very thin, and it's very lightweight for anybody that's never used it before. I mean, just amazing here. And if Dr. Dahlkemper, because I'm not the professional here, but I guess you just get a mold, you go, and how would the procedure work?
First, we usually have patients come in for a consult just to make sure 100% that they are a candidate, and probably 90% of all patients are. They can come in for a free consult, and then once we determine that they are a candidate, we take pictures, and then we take models, and then we send it to Invisalign. And what they do is they actually scan the models, and they have 3D, the teeth are 3D, and actually it shows how many trays you need and how the teeth will move. Okay,
my next question for you is, does it matter what your teeth look like? Some people might say, my teeth are so crooked that maybe I can't use Invisalign. Is that true?
Not really. I mean, I probably, out of 60 cases that I've done, I've probably only had to pull one tooth for someone who had a really crowded case.
Right.
So, I mean, the amount of crowding really doesn't matter.
Doesn't matter. I think that we have some before and after pictures that we're looking at right now. So is this, I think this is before.
This is a patient. These are actually some patients that I have in treatment. This is actually like a 57-year-old female.
Okay.
And she pretty much had crowding and an uneven bite. So she's currently, I mean, these are just some people who are in treatment.
Okay. So we'll look at the next one. Look at the difference here.
Here's a before and after. We did some whitening and, you know, for the after as well, but a lot of crowding in this picture, and that took about a year, I think.
Look at that. Now this is what I'm talking about right here, because a lot of people, they say, I think, you know, what I've got going on is just too much for Invisalign, but you're able to mold something for even someone like that. That's amazing. Where can they find you at Dr. Dahlkemper, like some more information? Let's just say, for instance, they want some testimonials or just have some questions about Invisalign. Where should they go?
There's a few different sources. Actually, on the expert site through ABC, we have a good video about Invisalign, and also our website has a lot of information, or you can just call and come in and talk to me.
Yeah, I was just going to say, can they just get a consultation, maybe come in, because they might have some personal questions about themselves that they won't get answered through that video.
Yeah, and our consults are always free, so they can just come in and talk with me and just see if they are a candidate. Or could be better than that.
Our favorite price of free. Look how Cheryl is just smiling, and I love it. Do you get it? Did you get it on the top and the bottom, Cheryl?
I did.
And you're doing just fine.
I have a crossbite, so it's working. She's working with me on the trying to get the crossbite right, because I never had braces as a child. Not being a minister's daughter with 6 kids.
Right.
We couldn't afford that.
I can imagine.
But they're great. They really are great. I highly recommend them.
Dr. Dahlkemper, I guess for different people and depending on what stage you're in, it would depend on how long you need to have it for.
Yeah, definitely. I have some people who are just 6 months for like minor treatments, and a lot of people who are in it for a year. But the biggest thing, they just have to wear it all the time. If you're not wearing it, it's not working. So
just make sure you're wearing it all the time. And that's with any type of treatment for anything. You know, you make sure that you do it all the time and stay consistent. Well, thank you so much, Cheryl. We appreciate you telling your story for us. Dr. Dahlkemper, thank you so much. And she is one of our ABC News 4 experts, so you make sure you go to that website, and all you got to do is look right there. They'll have more information, and like she said, there is a video up there if you have any more questions about Invisalign. Just visit Dr. Dahlkemper, because she's got your answers. Thank you, ladies, so much for coming. We appreciate it.
Thanks for having us.